Okay. Just one more. Yeah, Tarang, you can come.
Yes, sir.
Yeah. Okay. Good evening and welcome to this next Wednesday Orthopedic Musing with Dr. Professor Borate sir. And today we are going to speak on a very important topic, which is important not only for freshers but also for people in middle of their careers and climbing up their careers. The financial aspect of uh, orthopedic practice. So for further proceedings, I'll hand it over to Tarang, our moderator. Over to you, Tarang.
Yeah. Thank you very much, sir. And welcome everyone for another Wednesday. Today, this Wednesday is a very special one for all of us because it is the Bone and Joint Day we are celebrating. The week we celebrate starts today, and greetings on that day to Dr. Borate sir and our other Ashok Shyam sir and other listeners as well. So, in the past meets, very nicely chronologically, we have discussed from to start with the orthopedic curriculum, then the orthopedic residency, how to be a good resident, how to have a good practice, and what after that. You become a good orthopedic surgeon. You start a decent revenue. You have start having a decent revenue. What after that? Should one be complacent on that? The answer is definitely no, because needs to have sound knowledge on how to invest his earnings. So, in short, he needs to have a sound knowledge on the financial aspects as well. And like in our past talks, we concluded, and it is widely accepted, that a good resident ends up and becomes a good surgeon. Similarly, why not start a habit or have an agenda and a plan since residency days to obtain financial security? So, as the seeds are sowed in the residency days to become a good orthopedic surgeon, I think it is similarly having a plan since residency days is always reasonable, because, like it is rightly said, an amateur with a plan can definitely beat a mature with a genius without a plan. So, over to you, Borate sir, to start with how to plan or use the finances wisely during the residency days.
Yeah, good evening, Tarang, and pleasure being on this program. The thing is that when we are medical students, we are basically surviving on our parents' resources or our own resources. But when we join the PG training, we start getting a stipend or a little bit of money. And this is the time when we must realize that even though the money that we get is not very large, we need to understand that that money has to be properly managed and properly budgeted. Most of the when I was a resident, we just spent everything that we earned. I don't think anybody had any money that they were able to save. Uh, but now the money that is being paid to the residential stipend is considerably more than what it was in the past. And one thing that I have noticed is that there are two types of residents: those that do not have any financial support from their families or their parents, or very little financial support, and those that have comfortable financial support. So the attitude of these two groups is quite different. But I would advise anybody who, whether you have support or not, you should start, learning to live within what you are earning. This itself is a big training that all residents should inculcate. And even if you do have to spend something more than what you're earning, it should not be for a, um, you know, uh, it should be related to education. Like if you want to buy a book, or if you want to, attend some conference or some training. Those are expenditures that have got a positive potential in your life. But if you spend money that you don't have, or which is more than your income on expenditures like, entertainment, or, just having fun, that is not a good way of managing your resources or money. So I would say that the first and the most important thing we should start doing in residency is try to live within the money that we are paid, and do not borrow any money, especially on your credit card. That is going to result in your having a huge amount of money you have to pay back as interest. If some people have to take a student loan, then they should take a loan which is of a shorter duration than loan which is of a longer duration. Because loan for longer duration appears to be very comfortable because the monthly repayment is less. But we don't realize that all long-term loans require us to pay almost 3 times what we have borrowed. So we end up, if we have borrowed like 100 rupees, we end up paying 300 rupees by the time we finish paying our loans. Whereas if you borrow for shorter terms, then you end up paying about 2 times what you have borrowed. And that is always a better practice. And in the event that you don't have money to repay your loan, uh, you should have some kind of arrangement with your parents or somebody who can pay your finances to start paying those installments as early as possible. Try to avoid moratoriums, because moratoriums only increase the amount of interest that you ultimately pay back. Um, the other thing is that most of the residents are kind of indifferent to insurance, particularly health insurance and medical liability insurance. Whatever, because when you're young and you don't have any comorbidities, that is the best time to start a health insurance, because you will get insured for a very relatively less amount, and that amount will not keep increasing. So you must have health insurance. And I also suggest that whatever health insurance you have, it should be comprehensive. It should be not a insurance with a lesser premium just to avoid paying more premium. You should have a good insurance policy which has got very few exclusions or no exclusions, and which is comprehensive. The premium at that point in your life may be not very large, but it will, in the long run, it will be very good. And you can add other members, like if you're not married but you get married, you can add your spouse to that policy as well. Liability insurance also is important and everyone must have it. Life insurance is an optional thing, but if you, at a younger age, if you take out a policy which has a relatively less premium per year, it's not a bad idea. So this is something about the financial problems relating to what you should do with your money when you are a resident.
Resident. Yes.
Yeah.
So this is like because we are talking on finances, I can't help but recall some statement by Warren Buffett, who said, "If you buy things you don't need now, soon you will have to sell things you need." So similarly,
Yeah.
you have to learn to live within your stipend which you are receiving in residency days to come to a conclusion. So this is about residency. Now, what do you think when someone is aspiring to for a fellowship? For example, now the glamorous field in orthopedics or the high earning fields are the spine and the plasty. So does this future high earning aspect of a certain orthopedic field has got to do something with their in choosing their fellowship of a resident? Has it got any correlation?
See, first thing is that in today's world, anybody who's done an MS orthopedic or a DNB, if he plans to practice in a large city or in a metro or in a city which is got very good medical facilities, then he has to get trained in some subspecialty. Without that, see, even today, if you have training in subspecialty, you will get a better job. You will get, even if you start practice, you will be probably able to make a name for yourself if you stick to only that subspecialty that you have learned. You will have a much better career and a much stable and a good learning income generation. So I would advise all orthopedic surgeons who plan to practice in the bigger towns and cities, especially because they come from there or they have families there and they don't see themselves going to a smaller town or a remote area, then I would suggest that they must do a fellowship. Now, there is a very funny thing about fellowships. The data I have is, of course, from the United States. Now, the United States problem is that it's a saturated field of medical specialties. So they have almost as many doctors as they need. So the potential for doctors to earn is much less than in terms of increasing income. So that is why they have uh, a little different pattern. So somebody who's done a fellowship in spine and he gets into practice, the potential for him to earn money is such that whatever money he spent on the 2 years of doing the fellowship and whatever income he has lost because he has not gone into practice, both those can be recovered in just 2 years. That is how much money potential there is to earn. But the same break even is much less for hand surgeon. It is less for somebody who is doing shoulder or elbow. It is even less for those who are doing adult reconstruction and sports medicine. And surprisingly, it takes a very long time for those who are going to restrict themselves to trauma and pediatric orthopedics. This is simply because almost all general orthopedic surgeons, even though they do not have fellowship training anywhere in the world, are practicing trauma and they are practicing pediatric orthopedics, etc. So that is why the amount of work that flows to a subspecialist or a super specialist in these fields is relatively much less. Whereas very few general orthopedic surgeons, percentage wise, independently do spine surgery. So that's why almost all spine surgeries end up with the person who has specialty. So this is applicable to some extent in India as well. So my suggestion is that you must do a fellowship, but at the same time, you must understand that it will delay your earning money, and you will start earning money at a little later age, and you will end up spending a certain amount of money because many. Hello. Hello.
I think the recording has stopped. There was a prompt, Ashok Shyam sir. All right, sir.
Yeah. So the thing is that what many people don't realize is when they get seriously involved in fellowship training, they usually have opportunity or potential to go abroad for a year or thereabouts. It also involves additional expenditure, and that also delays your earning and starting of your practice. So all these factors have a bearing on your once you make that decision that I am going to be a expert in something. But I would strongly advise all people who are practicing in big cities and who want to become uh, good orthopedic surgeons and want to have a more robust practice and more job satisfaction to become experts at some subspecialty. Right.
Right. So now I myself feel that sometimes I feel it is easier said than done because it is my early days of practice. Why I feel that way is because sometimes we are short of knowledge. We are having limitations of knowledge on what is the proper channel or proper route to invest whatever we earn, and whom do we trust with the money, because as it is such a sensitive issue. So how would you like, and what our plans should be? So
Yeah,
something on that. So yes.
this is a good question. And what happens is that doctors, the problem with doctors is
It is fine. We can go ahead, sir.
yeah, the problem with doctors is that whatever money they earn, as long as they have something left over from after expenses, they feel that they're doing well and they're not doing badly. But there are two issues. One is they don't really plan their expenditure, so they end up with much less surplus than what they could if they planned their expenditures better. And the second thing is whatever little they have left over as savings, they have really no idea um, what to do with it, and they would be generally taking decisions which are not very well informed. Because there are many reasons for this, but most often it is because they are busy in their practice and they just think that as long as the money is with them and it's doing something, it's in the bank, it's in some form, it's money. And they don't realize that potentially money can, with proper investment, made to earn more money. They have very limited knowledge because most people do not have any education or any interest in the financial world. And we don't know who can tell us the correct advice. We actually don't want to learn or study or get real knowledge and become smart and knowledgeable. But the people around us usually are some insurance agent who keeps coming to us to renew policies, and he's very nice, he's very friendly, and he appears to be very trustworthy. And your own chartered accountant, you think that the chartered accountant would be a very knowledgeable and wise person about money, but it's not necessarily so. Then in the bank, we have a manager or some wealth person who keeps being very nice and very friendly to you and keeps telling you that he knows what is the best thing for you.
Yeah, recently there is a trend of relationship managers in banks.
Yes. And then there are some people who say, I am a financial advisor. Then your doctor friends also say, I am an expert. I'll tell you, "Ye aisa kar. Don't do this, do that." Sometimes patients also keep giving you advice. You have some relatives. So amongst this large number of potential advisors, you don't know whom should we listen to and whom should we trust. See, one thing that we must know is all these people, they, most of these investment instruments, uh, when somebody influences another person to buy a certain mutual fund or something, there is a commission that can be earned by that person. And although that commission doesn't really affect what you're investing, it is an incentive for that person to give you advice to invest in something that he is getting more commission out of. And those investments need not necessarily be the best investment. So there might be some funds or some investment things where they're giving a lot of commission to advisors or agents. And the agents will go to doctors and say, this is the best thing, isme invest karo. But that may not necessarily be the best investment. There may be other investments available which do not fetch commission to that advisor. The other problem is that doctors are very reluctant to pay a fee for somebody who will give advice. And there are, of course, other problems that most doctors who are specialists and super specialists have, that they start earning money late in life. I started earning money when I was 34 years of age. Till then, I was just working for a salary which was almost impossible to save anything out of it. Like doctors don't have any pensions or any, provident funds or anything. Doctors don't have any, they have to pay their own way uh, and invest their own money if they have to start their practice. If they want to buy some equipment, they have to pay their own money. They have to buy their own apartment or a car. And also, doctors have to pay for their children's education. So all these things are real problems when you start earning money late. So it's important that as a doctor, you should ask yourself, okay, what are my financial goals? Um, when do I want to retire? And how much money I need to save every year when I start making money? And what do I do with the money that I have saved? And do I have, and whatever I decide after talking to experts and make as your own plan, you should put it down on paper and keep referring to it whenever you have to make any expenditure decision. Then it will be very good for you. Now, I would advise that, there are two types of advisors. One are called SEBI registered investment advisor, and second is independent mutual fund distributor. These, you have to ask anybody who says he is an advisor. And if he is one of these two things, then he is a good advisor simply because they do not get any commission from whatever they are selling. They are not allowed to take any commission. Therefore, they will uh, ask for a consultation fee, a reasonable amount which is to be paid once in a year or so, or whatever is their expectation. You can always bargain and come to a figure that is good for you as well as acceptable to the advisor. Um, these are people, at least because they're not making any money out of making a specific advice, they will give you the best advice, or they can be trusted to give you good advice. The people that generally are not trustworthy are bank relationship managers and wealth managers who are working for somebody else, or even if they're working for themselves, they are getting commissions from the investment instrument. insurance agents are the same thing. They get sometimes very, very big commissions, and they end up selling you something that you will regret. I mean, this happened to me personally, so I know how bad it can be. Same thing with chartered accountant and friends. Sometimes friends may mean well, but most of these people also don't tell you how to save money, how to avoid unnecessary spending. These people are only interested in telling you where to put your money. Beyond that, and once they have got the commission, they are least interested in what happens to you after. So this is some things that I have learned over the years when I had to manage and whatever savings I was making as my practice went along.
Right. So rather than just collecting your wealth, you should be investing it. And like they say in the financial world, the power of compounding as early as possible greatly reduces the actual amount of money which you will be needing or using. So, and also the second advice which you gave is we should preferably have an advisor who charges a one-time fee rather than the ones who are getting commissions, like relationship managers, LIC agents, and CS. So now, sir, because this is a totally new aspect we are talking upon, can you give us a prototype on an average orthopedic surgeon should follow? For example, stating whether the education loan should be repaid in the time period of 2 years, and maybe he should, and then in the next slot of his practice, that is in his early 40s, he would be definitely earning more than what he used to be earning previously. So, what should be his goals in the next slot of his practice? And then coming closer to his retirement, what should be his goals, financial goals, when he's coming closer to his retirements? Can you just state a prototype or a flow chart in that way, sir, for an average orthopedic practice?
See, most of the problems that we have in the early part of our careers is we tend to buy everything that we need through loans. I would advise that please don't, even if you have to take a loan to say buy a TV set or a computer or a car or a two-wheeler, please avoid taking it on what is known as hire purchase or on a installment basis, because these are mechanisms which are very, very popular. They are sold to a lot of people uh, because they don't have any collateral or they don't have any security to give. But as a doctor, your income itself is an attractive reason for banks to give you a loan. So don't get into this hire purchase and installment. Take a loan from a bank. Even if you take a loan on commercial terms, you will be saving a lot of money in interest if you take a commercial loan. And I can tell you that uh, as a rough yardstick, if you take a commercial loan to say buy a car, most commercial loans have to be repaid between 5 years to 7 years. Whereas if you take a installment thing, they will give you a much lesser installment, but the loan will go on for about twice that period, that is 10 years. And in that, you end up paying almost 3 times the interest or twice the interest that you would have paid than with a commercial loan. So the advantage of commercial loan is you end up spending less in interest. However, it requires you to pay a more installment or a higher installment. So don't be afraid of that, because in all my career, I found that whenever I took commercial loan, I could, and I insisted with the bank that I should have a prepaying option. And most banks who give commercial loans are having prepayment permissions and options. So even if you agree to pay, say, a certain part of your loan in 1 year. If at the end of that year you are able to pay twice that amount, the bank will immediately recalculate your interest on the remaining money. And therefore, you end up spending less on interest if you prepay your loan faster. And that is a big advantage which you should always remember and not take any higher purchase or installment. The other thing is that you take loans to buy things that you really need. Don't take loans to buy things because other people have them. Um, because if you find it better to have some transportation rather than buying a car for 2 or 3 or 5 years, you should not hesitate to say, no, I must buy a car because my friends around me have all bought cars, and I would look very, people will say, iska practice nahi chalta hai if I don't have a car. So don't use these reasons to get yourself into debt and loans, which are going to be a drain on your savings. And you should plan that, all right, if um, after you start practice, within a year or so, you will get an idea of how much you are making. And you can safely assume that every year your income will increase by a factor of 20% at minimum. Uh, and therefore, it is you can use that and plan basically on how much money you can save. And based on that, you should try to pay off all loans and not have a lot of loans. The less loans you have, the more savings you'll have, and the more investments you'll have. And you must also have certain goals like, okay, in the first 10 years, I will save enough money to have a saving of 1 crore rupees, which means that I have to save a 10 lakh rupees a year. In the first year, I may not save that much. But if I save only 5 lakhs and in the next year I save 10, the year after that I might save 12. So by the time I reach 10 years, I will be very close to whatever I had decided. But if I don't have any goal, then what will happen is, even if I do have savings, I'll say that, okay, let me go for a trip, let me have a vacation, let me do something that is going to involve spending money, because you are comfortable with the idea that I've saved something at the end of the year. And that something usually should be something that you already have decided. Then automatically it will make you much more diligent in sticking to your goals. So that's what I would advise. And if you have to buy a car, okay, buy a car that is reasonably, mm, which cost you have to take a smaller loan. And any vehicle, any equipment that you buy, it depreciates in value. The minute it comes back from the showroom, its value is reduced by 10%. And in 3 to 5 years, the value becomes about 30 to 40% of what you paid for. So if you, and at the end of every 5 years or so, you will end up wanting to buy or replace whatever that is. In case of uh, cars, but in other things, around 15%, 15 years is what is obsolescence or depreciation time. So try to invest in things which are less expensive, and invest in things which you need only when you need them, rather than invest in, say, like a large house or a large apartment, because it's a good idea. The world is changing so much that you can start off with a smaller apartment and change to a larger apartment when you have more money. So these are some of the things that you should do while planning. But you should plan that at the end of 10 years, where will I be? How much money should I have saved? And for that, you have to ask yourself that, when I stop making money, um, and you should always plan for a practice for 30 years, because most orthopedic surgeons will start practice around 30 years of age. And most of them would reach the peak of their practice around 60 years. After that, whatever money they earn, they can earn money for another 10 years, maybe, or even more. But you should plan that whatever is my goal for retirement, the amount that I have to save, my nest egg, I should be able to accumulate in 30 years of practice. That's, I think, a very, very good plan to work with. And most doctors are used to a certain lifestyle. And if, for example, you plan that when I retire at the age of 60, I should have so much money in savings and investments that I should get a investment income of about 25 lakh rupees a year. To earn that kind of income, you have to have a saving target of 3 crores or more than that. And you had to do it in 30 years. So it's not a very difficult target. If you realize that every year in practice, you will make little more money. And secondly, you should also have some additional money that you have to keep accumulating for your children's education, and some money for large expenses like buying a bigger house or things like that. Or sometimes for some people, their parents are getting older, they need to keep some money aside for their welfare, their health needs, and so on. So all this you have to factor. And as I said, if somebody says that, okay, I don't think I can reach that target in 30 years of practice. So, all right. I mean, if you aim for a good target and you end up saving, say, 20% or 30% less, it's still better than not saving anything. So when you have reached an age of retirement and you have very little money, then you have the compulsion that you have to keep working as long as you can, because otherwise you can't live a comfortable life. So you shouldn't be in that situation. That's what I would say.
Yes. So in your early days, it is very important to have a realistic approach rather than having a materialistic approach on what not undergoing a peer pressure of having such materialistic things that my so and so colleagues has such a so and so car. In fact, very nicely you mentioned about having a house of your own, because that would be counted as something as an asset rather than a car or an electronic gadget, which gets counted as a liability, like you just mentioned. And right, sir, that's a very enlightening advice for early practitioners. And how one should invest and how one should diversify his income after retirement, or how he should diversify his income and gain the maximum at his retirement?
See, this is a very good question you have asked, because most doctors do not understand that the only difference between investments is that there are some investments that are giving you less returns, but they are very safe because there is very little likelihood of you're not getting that return. Like if you were to keep your money in a bank, and the bank as a fixed deposit, and the bank gives you a certain interest on that deposit, that money is fairly safe and you will get that deposit from the every year. Now, the percentage of that return may be uh, relatively less. And these kind of investments which guarantee a fixed return are called debt investment, which means that your money without a lot of risk, but you are getting a lesser return on your investment. There are instruments other than fixed deposits and public provident fund. See, you must also invest in instruments which are not taxed. Like PPF is an investment which you can accumulate without paying any tax. So now, if you can invest, you are allowed to invest 1.5 lakh rupees a year in PPF. So from the first year of your practice, you should put 1.5 lakh rupees in PPF. Why? Because the interest earned given by the PPF is say 7.5 or whatever. But you don't have to pay tax. So even at a later date, when that money comes in your hand and you spend it on something, you don't have to pay any tax. It is not considered income. So one should, from the first year, put in whatever is allowed in the tax-free investments. One should only put in other things after you have exhausted all your tax-free investments. And we always say that how much money you should invest in equity mutual funds, because there are two types of mutual funds: equity mutual funds and debt mutual funds. So equity mutual funds give you a higher return. They may, in a good year, give you 20, 25, 30%, even 40% returns. And on the lower side, they may go into a loss also. You may get no return. But on an average, you will get, say, 5% more than what you would get if you put it in a debt instrument, on an average. So they say that you should, uh, if you are like 30 years old, you should have, and you have 100 rupees to invest, you should invest 70 rupees in equity mutual funds and 30% in debt in mutual funds, because you don't mind taking a little risk to make more money. But if you are 70 years old, it is advised that 70% of your investment should be in debt instruments and only 30% in equity instruments, because you may not make more money, but you don't want to lose whatever money you have. So with each year that you grow older, you should take less risk with your investments. And that is what advice is generally given to uh, all investors, including doctors. The other thing that I would like to tell is that you must remain invested, whether it is in shares, whether it is in mutual funds. You should not go and think of short-term profits. If you don't need the money, you should not uh, try to sell something and reinvest in something. Because most of these advisors will come to you and say, Arey, you have in last year, your investment gave you 25% return. Now you sell it, take that 25% and then invest it in something better. So sometimes, a good investment which has given you 25%, in the next year also it will give you the same return. In the 10th year also it might give you the same return. So you must remain invested. And the longer you remain invested, the less tax you will pay and the less more profit you will make. This the advisors won't tell you, because every time they make you uh, redeem your investment and reinvest, there is some commission involved. So they will keep coming and telling you every year to sell something and buy something. But your attitude in general should be, if I, what somebody told me, my son is an expert in this. So he told me that if you have bought shares in any 10 companies and you forget about them for say 20 or 30 years, you will end up making the most money than if you were to look at what is happening to them and keep buying and selling. He says, because the accumulation of investment returns, out of those 10 companies, only 2 companies or maybe 1 company will do extremely well. And that company's returns will make up for the bad progress of the other companies. So statistically, the best way to look at investment is invest at the time of investment, choose a good instrument based on whatever knowledge and advice you get, whether it is in stocks or in mutual funds or whatever, even real estate. You have to look at what is a good investment rather than what is the cost of the investment. And once you have made that investment, forget about it for 30 years or 20 years or whatever. That way, you will spend least amount of tax and you'll pay least tax. And at the end of 30 years, you will be very happy with the returns. And this is what most good investors, investment advisors will tell you. But good investment advisors will tell you this if you pay them some money every year, rather than you don't pay them anything and expect them to earn out of commissions. Then the need to get commissions will make them tell you something that is not in your interest most of the times. Yeah.
Yeah, so to conclude in one line, what you said just mentioned about investments is like, do not put all your eggs in one basket. And
Sure.
yeah, so that was something. So now with the present pandemic situation, any it has become really difficult for loan repayments and daily expenses, maintenance of daily expenses as well, for probably early orthopedic practitioners and residents. So your views on this, how will it turn out in future if we invest now during this pandemic also, sir?
See, the thing is that what most people don't realize that during the pandemic, 1.5, 2 years, or maybe another couple of years, the income of most doctors uh, who are not in paid jobs or who are not working for a salary, and most of the doctors are not working on salaries, they are dependent on their income from practice. And let's face it, practice income has reduced and will continue to be reduced to a certain extent, because patients will be having less money themselves and they will be postponing decisions of elective treatments uh, for a long time, perhaps indefinitely. So your income is going to be reduced to a significant extent, or at least some extent. On the other hand, if you've already taken a loan, if you already bought a vehicle, all your repayments will continue and they will not get reduced. And even if you delay making some of those payments, you will end up paying more interest. So your loan repayments will remain the same. Whatever taxes you're paying, like property tax, tax on your vehicle or whatever, they will not reduce. Your expenditure on your household will not reduce. Your expenditure or your electricity bill will not get less. So all this remains the same. So you will end up saving less. Um, Maybe the expenditure on education of your children will increase because you'll have to buy cell phones for all of them. You might have to buy computers. Then some of your dependents or your parents will have more difficult times and they may need some help from you. So those expenditures will increase. You might decide to buy more insurance for health and other things, which again will lead to increase in your expenditure. There will be some reduction of expenditure, like you will not be able to go and see it. Last 2 years, nobody has been able to see a movie in a theater. So your expenditure on eating out, on entertainment has reduced, holidays has reduced, and sometimes you hire less servants because servants they find it difficult to come. So these expenditures will reduce, but on the whole, everybody who is in the medical profession has experienced a reduction in savings in this period, and there's nothing you can do about it. So there's no point in being unhappy about it. Uh, I would only say that uh, if your savings is reduced, then try to see if you can reduce your expenditures to whatever extent it is possible. And try to see that your savings remains closer to what your goals are, even during the pandemic. It's difficult, but we should all try to do that.
Right, sir, absolutely. So now suppose he is a successful orthopedic surgeon approaching his retirement age who has invested very nicely, diversified his income, not hoarded his money. And what do you suggest, just out of inquisitiveness, what do you suggest? And he decides to retire from clinical practice. What do you suggest post-retirement life should be like?
Well, this is a very interesting question that is going to face more and more of doctors in India in the coming years, simply because in the old days, say 30, 40, 50 years back, doctors were not really earning that much money. So doctors didn't really retire. They continued to practice for a long time. But now the pace of practice, the amount of stress and effort that one has to make to earn money, even though one may earn more money, uh, leads to a situation where at a certain point you uh, should plan to retire. If you, for some reason, are unable to reach your financial goals, you may want to work a little longer. But otherwise, you should plan to retire, as I said, at least around 60 years. But apart from that, you need to also remember that you must have a healthy lifestyle, you must exercise yourself, even from the time you are a resident. Because if you have healthy exercise and fitness habits, your body weight is controlled, you abstain from any vices, then when you come to your retirement, you will be extremely fit and healthy. And you'll be able to enjoy the free time that you have to do whatever you want. And remember that, like for me, both my parents passed away in their early 70s. But most of us now are going to live longer than our parents. So many of us will live up to 80 and even longer. So we must understand and make provisions for that. People ask me, retire hoke karega kya? I mean, what do you do after you retire? You you will get you will degenerate. You will become a useless person and so on. So it all depends what you want to do. If during your life, apart from being doctor, you have also have some interest, like some people like to read books on various topics. Some people like to travel. Some people like to uh, 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 go for entertainment, music, whatever. So if you have other interests than your practice during your practice life, then when you retire, you can devote more time to those interests and without any guilt, so that you will be much more able to enjoy those hobbies that you have cultivated or you like uh, over the years. Because if you want to remain active in orthopedics, you can attend conferences, you can write about your experiences, and so on. There are many things that you can do to, once you decide that you are going to be involved in orthopedics, but you don't necessarily have to be involved in making money out of it, then there are so many things. You can work in associations, you can work in so many NGOs that are working to in the field of health. The best part about retirement, according to me, is that you now have much more time to spend on your own interests with your family. You can travel more. You don't have to worry about uh, your schedule. I remember when I was in practice, I could not be away from my practice for more than a certain number of days. So it was always like 5 or 7 days Even if I had to go abroad, I had to come back in a short time. So all that is not necessary once you are retired. And naturally, who will be the people who will be able to enjoy retirement best is those who have enough money to live comfortably, those who have interest other than their practice, and those who are confident in the knowledge that your self-worth is not dependent on being a doctor or an orthopedic surgeon. You are still, even if you are not practicing, if you are not an orthopedic surgeon anymore in that sense, you are still not a useless person. You're as good as you were. And you don't have to confuse your own feeling about your self-worth with what you think is what other people perceive you as, And other than that, I think uh, retirement is something that should be looked at in a positive manner, and it's something that you can uh, share your wisdom, share your knowledge, and be a good influence on the generations that are following you, and also not be a burden on the younger generation simply because are you haven't planned your retirement well, or for whatever reason you are unable to lead a comfortable life. So these are some of the things that I would say.
Yes, sir, absolutely. So try and inculcate and practice a hobby as early as possible in your early days, and post retirement, when you have enough money, you can practice that hobby. And you can also not be just dependent on your self respect being attributed to only your practice. And you can also spend a good quality time post retirement if we follow these things. So to sum up, sir, start planning early, start investing early, and like they say, a stitch in time saves nine, and that should help you in diversifying, in compounding your revenue, and at the end having a wonderful post-retirement life. So I think today's talk not only was not only for just orthopedic surgeons. For the matter of fact, any physician would gain a lot of insight on how financial investment should be done, I suppose. Just an overview, at least, about financial investments.
And I would make one suggestion to anybody who has listened or will listen to our discussion in future, and that is that you can ask uh, questions to people like us, people who are doctors like themselves and who have a little more knowledge and who have given a little more thought to all
Yes.
these things. Because we will give, because each one may have a, a, a unique set of problems or a unique set of circumstances, and he may be confused as to what he should do and what is the best way that he should manage his finances considering his set of problems. Like somebody may have a child who is having some health problem, which is of a long duration and which is going to require some special provisions in financial terms. So each one of us may have a different set of difficulties or situations that need to be in which they need some advice. So it is much better to seek advice from somebody who has got more knowledge from your own field, because first of all they are giving that advice out of no ulterior motive and no financial benefit. And the other thing is that if you go to a financial advisor, he may not be having any experience as a life coach. Whereas somebody who's been an orthopedic surgeon like you all his life and who's gone through the same problems that you have will be in a much better position to advise you in everything, including your finances. That's what I feel. And in today's technology and in today's social media and today's rapidly changing world, uh, every one of us must look at having somebody like a mentor, somebody like a coach, whom one can turn to and very frankly be able to articulate and seek advice for the problems that we may face, especially in our financial decisions.
Absolutely, sir. Every practitioner has his or her own set of struggles, which may vary from other, and it is very subjective on how big the struggles are and how small the struggles are. So, like I said, not really probably an expert financial this thing, but an overview of how a finance of any physician or a medical practitioner should look like is what we discussed today. And I'm definitely sure that not just orthopedic surgeons, but any physician or a medical practitioner would be gaining much insights from our talk today. Extremely thank you very much, sir, for sparing time for us today. I can suppose you had a very hectic day today because of the bone and joint day proceedings throughout the internet and throughout the city.
Yes.
And on social media and on internet, we have OrthoTV who has been conducting not one, two, but several bone and joint day throughout India. And today is the first day of the bone and joint week. So even thank you OrthoTV for being consistently delivering and not skipping today's Wednesday.
Yes, of course.
Yes.
It's a very important event for us, the Wednesday musing. So we
Yeah.
always
Thank
keep
you.
it on time.
Thank you.
Okay, sir. Then thank you very much. We'll wind